My name is Dr. Jeremy Tharkur. I'm a family medicine physician with Baptist Health. Finding a way to balance out a patient's personal life with their personal health is very difficult. As a physician, every decision you make needs to be with you and the patient. It cannot be a patriarchal decision where you say, you do this, you have to do this. No, it's what can work for you. How can we best maximize your health so that way you are feeling better and you're also being the best person that you can be. I'd probably say the most memorable patient I've ever had to deal with was this 67-year-old gentleman that I met one day on my way into clinic during residency. And he was very nice. We had a very short 2-minute conversation in the elevator, and just so happened he showed up on the schedule. When I walked into the room with the patient, his blood pressure was over 200. And he was not talking the same way how he had been 5 minutes ago. But he was convinced he was fine. I said, no, you're having a stroke right now. You have to stay in the hospital. He finally went to the emergency room. When they finally did the CT scan, he had bilateral hemorrhages in his brain. Thankfully, he was saved and he got to go home and see his wife again. The most common ailments that I treat would probably be back pain. I was lucky enough to train my first 2 years of residency in a hybrid DO-MD program, so I got a lot of extra teachings in how to do osteopathic manipulations. I've had several patients who walk out of that room saying, I have no pain. And you did that without giving them a pill, you did that without sending them to a specialist, you did that with 15 minutes of putting your hands on the patient and showing them how to work their body properly.